Hi, everyone. Thank you for joining us. We're just going to get started in just a moment. We're just waiting for everyone to join us, and then we're going to log into our Facebook Live as well. All right. Good afternoon, everyone. My name is Anthony Volkar. I'm the Public Information Officer for the Yolo County Office of Education, and I'm also one of your facilitators today on behalf of Resilient Yolo. So you're joining us for actually what is the third in a four-part webinar series that we've been hosting about how to build a resilient community here in Yolo County. And our virtual workshop series is concentrated on methods to integrate resilience building and trauma-informed practices into your personal work, your work life, and your family life. Now, all of our workshops have been recorded and they're also getting posted on our Facebook page. So if you go onto Facebook, if you look under facebook.com/ResilientYolo, you'll be able to find the previous two events. And we also have a YouTube channel as well. If you would search Resilient Yolo, you should be able to find the recordings of the last two previous webinars. And just briefly, a bit of a background on Resilient Yolo. The organization was formed in 2014. It's actually a community-based collaborative with an interest in strengthening the resilience of Yolo County by providing education about adverse childhood experiences, or ACEs. And in a 1995 study, a study on ACEs identified a link between ACEs exposure and a higher likelihood of negative health and behavioral outcomes. So I'm really excited that we've been joined today by some partners that we have at CommuniCare. So I'm just going to go ahead and introduce them on. And as I introduce you, if you want to turn your camera and introduce yourself to the group. So first up, we have Sara Gavin. Sara Gavin serves as the Chief Behavioral Health Officer at CommuniCare Health Centers. She is a licensed family, marriage and family therapist, and a licensed professional clinical counselor. And as the Chief Behavioral Health Officer, she oversees a team of over 100 team members who provide services in multiple service locations, including clinic sites, school sites, and the juvenile detention facility. We're also happy to have Dr. Eidson-Ton. Dr. Eidson-Ton has practiced full spectrum family medicine from birth to death, including obstetrics, for over 20 years. And she is also professor in the Department of Family and Community Medicine at UC Davis. And last but not least, we have Dr. Erika Roshanravan. She is a family physician at Hanson Family Health Center in Woodland, which is fantastic. She is part of the CommuniCare leadership team for the ACEs Aware grant that was tasked to build a trauma-informed network of care across Yolo County, and the initiative to transform all CommuniCare Health Centers into trauma-informed, resilience-oriented healthcare centers, which is part of the reason why we're having this conversation today. So with that, I'm going to go ahead and turn it over to the group. Thank you again for being here and joining us today.
Thank you so much for the introduction, and thank you so much for having us today. We're excited to be here to talk about resiliency in healthcare. So we're just going to take a moment to share our slides. So here we go.
Ready?
Yes. So what are we talking about today when we talk about resiliency in healthcare? That is a really large topic, and it includes resiliency in healthcare systems, resiliency in healthcare organizations, resiliency in healthcare providers, and in healthcare consumers. And for the sake of today's presentation, we decided to primarily focus on resiliency in healthcare workers, because really when there's no resiliency in healthcare workers, there can be no resiliency in the healthcare system either. It's sort of a lot like the oxygen mask analogy that is used a lot on the airplane. You have to put on your own oxygen mask first before you're able to assist others and help others. And as the last workshop in this group was on resiliency in education, and certainly a lot of this applies to other systems as well. If educators are not well, the education system is not well, and so on. And so a lot of the concepts we'll talk about are not entirely unique to healthcare, but we will focus on healthcare workers for today. So what are our objectives? We will go through a reminder of what resiliency and trauma-informed care are, We will talk about mental health and burnout in healthcare workers. Where are we at? How does that look like? And what are the consequences of burnout in healthcare workers? We will talk about the concept of moral injury and burnout and what that means. And we will talk about different ways of improving healthcare work resiliency, what can really be done about it. And we'll do that also with some examples of programs and initiatives that are currently going on at CommuniCare Health Centers. So resiliency, what is it that we are talking about? We are talking about resiliency is the ability of individuals, organizations, and communities to respond to and cope with adversity and uncertainty, adapt to challenges and changes by bouncing back or bouncing forward to a pre-event level of functioning that is adapted to the post-event reality. Building resiliency also means to be better prepared for the next stressful situation. And these are definitions, do you mind going back one more? These are definitions from SAMHSA, sort of different definitions taken together. And I think 2 years into a pandemic, we all have a really good understanding of the truth and the necessity of resiliency viewed in this way. And there's a couple things here to note. There's these levels can really not be viewed in silos. There's no such thing as individual, organizational, or community resiliency without the other levels. They all have to be addressed. And it's also always a good reminder to keep in mind that resiliency does not mean the absence of adversity or disagreements or conflict, but it really means the ability to tolerate conflict or stress or adversity and move constructively through it. Now, what is trauma-informed care? The SAMHSA, again, has a great definition of that. It means an approach to care that promotes a culture of safety and empowerment to foster recovery and healing through safe and collaborative relationships. And we now often expand this acronym of TIC to TIRO, which means trauma-informed and resiliency-oriented care, really emphasizing this resiliency piece that we are also here to talk about today. And there's two concepts that I want to highlight in trauma-informed care that are really important. And the first one is universal precautions. And this is really any time any human interacts with another human, we're going to assume a presence of a history of trauma and act accordingly. The other one is that when we talk about trauma-informed care, sometimes we are tempted to think about just how we as healthcare providers treat healthcare clients or patients, but it really applies equally to the clients, such as the patient, as well as the providers and staff. Same as we already talked about the parallels with education, where it applies to students, but just as much to the educators as well. And now I will hand it over to Dr. Eidson-Ton to talk about the next section.
Yes, thank you, Dr. Roshanravan. So I am going to just talk a little bit about the problem that we're trying to solve today. And really, I'm going to show you some information about the fact that many different mental health indicators have worsened for healthcare workers during the COVID-19 pandemic. And so there's been multiple studies around this showing that burnout, insomnia, as well as mental health disorders like anxiety, depression, and PTSD have all increased for healthcare workers during the pandemic. So this was a review study of many different studies looking at the mental health decline in healthcare workers during the COVID-19 pandemic. And some of the indicators that were looked at in these studies are here on the slide. So with insomnia in the various different studies, there was anywhere from 35 to 75% of healthcare workers reporting insomnia. And this was definitely higher for frontline healthcare workers. And all of these indicators were actually higher for frontline healthcare workers, especially those directly caring for COVID-19 patients. 2/3 actually of frontline healthcare workers have experienced symptoms of anxiety and were diagnosed with anxiety on a formalized questionnaire in one study. And 17% of those healthcare workers actually met the criteria for severe anxiety. 15 to 65% of healthcare workers met criteria for depression in some studies. And again, this was significantly higher for frontline healthcare workers. And PTSD has also been something that's been increased in healthcare workers during the pandemic. And nurses in particular have been at risk for PTSD, as well as other people directly caring for COVID-19 patients who've passed away during the pandemic. So even before the pandemic, burnout has been a problem for healthcare workers. And this is a study about physicians that was done in, it was a survey done in 2011. And to define burnout, burnout is a state of physical or emotional exhaustion that also involves a sense of reduced accomplishment and loss of personal identity. And that's a definition from the Mayo Clinic. So even in 2012, well before the pandemic, more than 45% of physicians had at least one symptom of burnout. And those at highest risk for burnout are also those at highest risk for healthcare, for mental health issues during the pandemic, which are frontline physicians, family physicians, internists, and emergency physicians, people directly working with patients basically on the front line. This is just a very not old, but a very well-known model, this demand control model about burnout risk. And this was actually developed back in 1979 by Karasek. But this graph is actually from a more recent study talking about burnout in healthcare workers. But the basic point of this is showing that the more job demands that you have and the lower control that you have around those demands, that's where you really have this increased risk for psychological and physical stress. And that's where you have an increasing risk of burnout. So that definitely describes a lot of healthcare jobs where there's a lot of responsibility and a lot of demand, and sometimes not a lot of control over your environment or the way that that care is done. And so this is also related to moral injury. So moral injury was first defined in war veterans, actually. And the definition, this is from a study back in 29 of war veterans. The definition of moral injury is harm that people experience. It can be psychological harm, physical harm, after perpetuating, failing to prevent, or bearing witness to acts that transgress deeply held moral beliefs and expectations. And healthcare workers can also experience moral injury, and there's been a lot written about this, actually even pre-pandemic, particularly when they feel like they're working in a system that doesn't allow them to care for their patients in the best way, whether that's from insurance constraints, financial constraints, whatever that is, or and related when they feel like they have little control over impacting patient outcomes. They have this sense of moral injury. And the COVID-19 pandemic has increased the potential for moral injury. These are just a few examples. One is the rationing of personal protective equipment for healthcare workers, but also for patients really early in the pandemic, which of course leads to decreased control in your work environment. Also, that initial lack of access to vaccines, the initial vaccine rollout was very centralized. It was very hard to access for primary care physicians. And so that was really challenging when they were the ones actually seeing patients and wanting to give the vaccine. And then also just vaccine hesitancy from the patients themselves, as well as vaccine disparities, really leading to unnecessary illness and death. And all of these things can increase that sense of moral injury that healthcare workers experience. And moral injury leads to burnout, basically. And what are the consequences of burnout for physicians? This is from a study of physicians, but of course this could be applied to other healthcare workers as well. In physicians, there's definitely evidence that burnout is associated with increased substance use and sometimes substance use disorder, relationship problems, including divorce and other types of personal consequences like that, and also suicidal ideation and other mental health issues as well. There are also consequences of burnout beyond just the individual healthcare provider for the healthcare system itself. There's evidence that burnout is associated with more medical errors, also associated with decreased patient satisfaction, and is associated with early retirement for some, as well as during the pandemic, we've certainly seen lots of career change, people moving away from careers in healthcare. And all of that leads to a decreased workforce, which is kind of a vicious cycle. And burnout in the healthcare setting has definitely increased during the pandemic. So back in 2019, before the pandemic, 35 to 54% of US nurses and physicians had burnout symptoms. And then in September of 2020, 76% of healthcare workers reported exhaustion and burnout in a survey done in September of 2020. So I've kind of done the depressing part of this talk, and now we're going to try to move towards hope. And I'm going to turn this back over to Dr. Roshanravan to talk about some of the ways that we can try to address this.
Thank you so much. And before we get to the more hopeful part, it's actually really helpful also to think just a minute about what is not working, because in the last 10-20 years, there has been certainly a growing awareness of the need for wellness programs and resiliency in healthcare workers. But there's a number of initiatives that have just not been shown to be all that helpful. And those are, if the first group there is self-care programs that entirely put the responsibility on the individual healthcare workers' self-care, such as saying, hey, you need to exercise more, you need to sleep more, you need to eat healthier, but not creating the structure and the schedules that actually create time and space and flexibility and energy to actually participate in this program. This is often also, the analogy is used there that the canary in a coal mine can meditate as long as they want, they're still gonna die. And so this, if we say, this really self-care advice without context tends to not work or frustrate healthcare workers. The second one here is excessive reliance on extrinsic motivators alone, such as the carrots and stick model, like productivity-based bonuses or awards. And there is nothing wrong with extrinsic motivators, but they do tend to be meaningless if they are not based on a foundation of intrinsic motivators, such as having voice and having control, having professional development, and having one's input being valued. And also the absence of extrinsic motivators tends to feel like punishment rather than the presence feeling like a motivator. And one more thing to this is, if you're going to survey your workers on what they would prefer in terms of an extrinsic motivator, you better be prepared to follow through on your survey results. That is one of the worst things. If we ask, we need to be prepared for the answer if we want to be conducive to wellness. And the last thing here is sort of a one-size-fits-all approach to wellness and resiliency in healthcare. An example of that is a top-down implementation of a 30-minute break at lunch where everybody needs to go outside and connect. Because for some of us, we might say, hey, I need those 30 minutes to get some stuff done so I can go home to my family 30 minutes sooner. And it might make me very upset if I'm told I needed to do this one wellness program that might work for somebody else. So what does work? What do we need to do? This is a model that was developed with a group from Stanford and Mayo Clinic, UCSF, and USC, and it really is this three-tiered system that comes up in many different approaches to wellness. we need to look at the individual wellness, but we also need to look at organizational resiliency, societal resiliency, and one of these cannot exist or function in a silo without the other. And a similar three-tiered approach has also been used in the Charter on Physician Wellness that was published in JAMA in 2018 and many others. And unfortunately, right now, a lot of the wellness initiatives in healthcare really focus a lot on this individual wellness self-care ring that is in the middle here. And again, we really need the organizational and the societal levels to create the structure, the time, the space, the flexibility to allow the individuals to participate in that innermost ring that is important, but we have to create the structure around it. So at the organizational level, there is the concept that was developed by Dr. Schanefeld and others at Stanford and at the CMA Wellness Services that is called wellness-centered leadership. And this model was developed, focused on physicians, but many of these concepts really apply to all healthcare workers and really to many workers that take care of others in any capacity. And I really like this concept because leadership sets the tone. We already know that when leadership just tells their workers, you need to take care of yourself, or did you already exercise today, sort of like with the stern finger up, it just tends to not work. And so leadership is really key to all these initiatives to make it work. And Dr. Schanefeld in this study took the core skills and qualities from some foremost leadership philosophies and put them together with the evidence of the relationship between leadership and physician well-being, and came up with this pyramid. And so the foundation here is care about people always. So caring leaders would demonstrate respect and empathy and curiosity in the teams they lead and really validate the individual and their contributions and care about them. He also really emphasizes that also for leaders, it all starts with caring for themselves. So the model really stresses that as well. And it's very interesting that actually empathy has been shown to promote leadership effectiveness more than cognitive task proficiency. So this really tends to work out well for leaders. In the middle section here, it says cultivate relationships. And they are emphasizing that the primary function of leaders, of a leader in healthcare, is to unleash the talents of those that they lead and use those talents to accomplish the mission of the group. And in order to do that, it's again, the leader needs to recognize each individual of their team with their unique needs, their unique talents, their unique interests, challenges, and ambitions, and also pay attention to the interrelationship of team members. How are we going to use our team? How are we going to align our different talents towards the mission and the goals of the team on the organization? And again, those are giving people that control and being heard fosters those intrinsic motivators that we talked about before. The top level here is leaders inspire change. And that is very inspirational and also aspirational in many ways. But it means to encourage each member of the team to think beyond the status quo and empower them to drive change and actually be creative and think about it. And unfortunately, a lot of healthcare has been moving in a direction of primary focus on standardization and controlling people to stay inside those boxes. And healthcare is really complicated, and we are taking care of humans, and humans are complex, and we are humans who take care of humans. And if healthcare leaders can really encourage and empower their team to think outside of the box and to value their contribution and their creativity, healthcare workers will feel better, and our patients will be better taken care of. And so overall, in summary, we can really replace this whole pyramid with saying we need to be seen. So leadership is there to be seen. Leadership needs to be seen. And any of you who have children or who have thought a lot about parenting may see a lot of surprising or not so surprising parallels here with the way what tends to work raising children, belonging and significance, being seen. So those parallels are probably not very surprising, but it really just goes into those same systems. Now, at the outermost ring, sort of the societal, the national level, there's a lot of actually really exciting things going on right now, sort of a movement in the direction of trying to help address this crisis. And one of them is the National Academy of Medicine that has built a collaborative on clinician well-being and resiliency. And they actually came up with a 335-page action report in 2019. And there's a lot of really interesting things in there if you're interested to take a look. And there is also a resource collection on resiliency and well-being that I linked on this slide that has a ton of resources and articles and studies. And then hot off the press from last week, Dr. Lorna Breen Healthcare Provider Protection Act was passed by Congress. And it is asking HHS to provide grants and conduct campaigns and do research to improve healthcare workers' mental health and resiliency. What it'll mean in details, we will see, but it is certainly a very exciting direction. And with that, I turn it over to Sara Gavin.
Great, thank you. So we want to now transition to share how we've applied some of these learnings and concepts and philosophy to the work that we're doing at CommuniCare and give some specific examples. As was shared, the last few years have been extremely stressful for healthcare workers and workforce in general, but it's also been an opportunity for us to apply some of these ideas that we've wanted to do philosophically for a really long time. And so to ground ourselves in kind of the context of where we're coming from and where we've wanted to go, we wanted to share this quote by Sonia Renee Taylor, which is, we will not go back to normal. Normal never was. Our pre-corona existence was not normal other than we normalized greed, inequity, exhaustion, depletion, extraction, disconnection, confusion, rage, hoarding, hate, and lack. We should not long to return, my friends. We are being given an opportunity to stitch a new garment, one that fits all humanity and nature. So for us, this has been a time of reflection, vulnerability, and opportunity to do things a little differently. Yeah, great. So for many of us going into the helping profession, whether you're working in healthcare or in education or really any way that you're working with the public, you can see on the left, this is kind of how we show up in the world. We care about people, we care about healing, we wrap around, whether it's our students or our patients or clients, and we want to attune to their needs. And if you compare that image to the image on the right, which is maybe after the patients or clients are gone and we're sitting with our colleagues, that often we're challenged to share the same level of attention and interest in each other that we extend to the patients and clients and students and customers that we might serve in our industries that we work in. So when we ground this conversation in trauma-informed care and collective care, we're encouraging that we're sharing the same love and attention that we have for the people that we serve, for also the people that are doing this work. And so this pandemic, although really challenging, has actually pushed us there, because this experience that we all went through is not just about our patients and clients, but we were going through it at the same time with all of the people that we worked with. So we're working through something collectively together that's pushed us in a direction that we wanted to go for some time. And so when the shutdown happened and many people were moved remotely, kids were out of school, it pushed us to learn about each other in more intimate ways than we had never done before. I mean, literally through video, you could see people's homes, you met their kids, their pets that they lived with, the context of the life that they're living. And so because of that, we built stronger relationships. I learned more about the people that I worked with than I had before this pandemic, because in some ways, to negotiate the work we were doing together, we had to negotiate and know about what was going on for people personally. And so there was empathy that was built, and trust and connection that we hope to carry through past this pandemic. And so while it's been extremely stressful, it's also been an opportunity for us to sit in vulnerability with each other and develop trust and relationships, which is really foundational to trauma-informed care. And a lot of what we've learned, we want to continue forward. Many have seen this quote. This is floated around on social media for a long time. In the rush to return to normal, use this time to consider which parts of normal are worth rushing back to. So that's part of the work today, which is thinking about, how things used to be and really looking at these changes that we've made as an opportunity and really seeing the value in some of the things that we put into practice during the last 2 years that we don't want to go back to and we want to highlight. And there's lots of things we do want to go back to, of course. So as Dr. Roshanravan mentioned, the term self-care has evolved some, and I think it's become a little bit more of a buzzword that conjures up images of tasks that you didn't get to, or like something that you can feel shame about that you didn't get in your daily meditation or walk or exercise or whatever the list is. And so we really are trying to shift the language to recognize how important collective care is in self-care and that both matter. So self-care is saying I need to look after me, while collective care is saying we need to look after each other. So it's not that self-care isn't important, we have to do that, but it has to be both. And an example that's sort of a simple example is me taking a vacation is self-care. That's my responsibility, right? To take care of myself, to fill up my cup, right? But if I feel like if I take a vacation, my colleagues and boss are going to feel resentful for me that I'm not here. They're going to be contacting me on my time off. I'm going to come back to 500 emails from the day that I took off, all the things that I didn't do, and then have to work late to catch up for the day that I took off. That is not going to make me want to take care of myself. And so both have to happen. What if my boss said to me, Sarah, I noticed you haven't taken vacation in a while and I want to support you in taking time off. What can happen for you to feel like you can do that? Or what if my colleague said, I know Sarah's off today and I'm not going to contact her, this can wait. Or maybe I won't even send that email and I'll just follow up with her when I get back, so that when she gets back, she feels like, wow, people really supported me in taking time off and that it matters. So that it's just a simple example of the way that self-care and collective care work together. And we need to think about whatever system we're working in to make sure that we're creating an environment in which self-care is possible. And so we want to share some examples of things we've done. To Dr. Roshanravan's earlier point, it's not a one size fits all. Someone might say, I want donuts every Friday, and that doesn't mean that everybody wants donuts on Friday. So we've tried to kind of add elements and variety and choice for people to engage in what they feel comfortable engaging in. So we're going to go through some examples of that. Our TIRO training, so all levels of the organization are being trained in trauma-informed care and resiliency practices so that we have a shared language and a shared intention. So people, our CEO has attended, trainings, and every, staff members have, and so that we're acknowledging and understanding them from the top down that this matters to us and that we have some language to be able to share and work for each other. During the height of the pandemic, we started what's called Self-Care Tuesday, which has become more of a collective care Tuesday practice, but it was a virtual weekly opportunity for people to come in, and we had rotating facilitators that was our own staff and providers from primary care and behavioral health and perinatal divisions to bring some aspect or some skill that someone wanted to share that would help people in their self-care. So we even had a comedian come one week and do a set. We've had primary care providers teach about stretching and muscle relaxation, behavioral health, about mindfulness, and we've used humor, but it's a way to also get to know each other. So we had people join from lots of different organizations that or departments in our organization that don't normally work together, coming together and kind of acknowledging that this is a really, really hard time and we need to connect and learn about that. Flexibility in scheduling. Can you go? Do you mind? Okay, great. It's flexibility in scheduling. So this is huge during the pandemic, and we hope to continue this on. But thinking about balancing, taking care of people in our workforce, but then also taking care of our employees and having flexibility in schedules and circumstances for people. Transparent communication, that's talked about a lot in trauma-informed care. How do we be transparent? There is a lot of anxiety that people hold when they don't know what's going on. And we tend as human beings to fill the gaps on our own, which is not always helpful information that we do that with. So during the pandemic, there was a tremendous amount of unknowns. I mean, it was daily, questioning about what is even happening. So something that Dr. Eidson-Ton did is she sent a daily email. Every single day she wrote an email that explained what we thought was happening, what we're thinking about it, what we're planning to do. And a lot of it contained vulnerability because we didn't fully know. And to be able to just share that from the top to say, we're thinking about you and we're not holding our cards to our chest, we're sharing things that are going on. And so that transparency and communication you'll see as a thread in these activities that we're sharing is that lots of people from different levels of the organization from the top down are talking and sharing openly about what's going on and listening and receiving feedback, trying to dismantle some of that hierarchy that happens in decision and dissemination of information. Stay interviews, if you're not familiar with the practice, it's an intentional interview practice that is sort of an alternative to exit interviews where HR would interview an employee who's left to get feedback about how things went here. Stay interviews is a practice to help people to stay here and honor their experience while they're here. So this past year, leadership level individuals met with every single employee at this organization personally and privately to get thoughts and feedback and opinions, including specific questions around diversity, equity, inclusion, and belonging, and ways that we can do better, and then be able to, of course, take action on some of that feedback that was received. We also have ongoing committee work that happens around diversity, equity, and inclusion in multiple subcommittees. Again, another opportunity where all levels of the organization can have input and influence and work together. It was talked about before about feeling like you have control, right, as part of your work. And so part of this is having influence and being able to share ideas and see your ideas be implemented. And that's really important, including our TRO Champions Committee, which is a similar concept of people coming together and learning and sharing about ways to make our organization more trauma-informed. Something that was also developed is a SAFE group, which is the acronym is Supporting Activism and Advocacy for Fostering Empowerment for People of Color. So this is a group that's during work time, twice a month, only for persons of color at CommuniCare that are not in a manager or leadership level role. So it's a way to create a safe place to process experience, gain support, and gain community. We've also practiced a curriculum called Healers Arts, which previously we hosted a few times actually in person before COVID, and we want to bring it back virtually and maybe in person in the future. But it's a curriculum designed by Dr. Rachel Remen that was originally, you can correct, my colleagues can correct me if I'm wrong, for medical students. But we started it and expanded it to all providers at CommuniCare to come together. And the intention simply behind it is to reconnect with meaning and purpose and the why we're here, which is really about addressing clinician burnout, not just for providers in primary care, but for behavioral health and dental, and any ways that we can come together and find meaning and connection. And we received just really wonderful feedback about the model itself and connecting to the why and purpose, and it being critical as to combat burnout, but also sitting with our colleagues and realizing how much we have in common. And oftentimes we interact in times of stress and urgency. And so to sit and be together and reflect on why we're all here and see the commonalities is just really impactful to our employees. And then last on this slide is every person in the organization is trained in an evidence-based communication practice called CARE, which is Connect, Appreciate, Respond, and Empower. And it's simply just a form of respectful communication that really overlaps and aligns with lots of the trauma-informed care principles that you learn about. And just a few more activities. So we also was our practice to do 360 evaluations. And this is an evaluation that some of you may be familiar with, but when someone has their performance review, often they're reviewed only with insight from people that are higher up than they are. And 360 evaluations is an anonymous survey where we get feedback from all levels of the organization. And so it's just another practice where people's opinions are valued and heard, and you're not just hearing from people in authority roles. And it also means that the way that we interact matters to everyone. It's not just being nice and pleasant and responsive to your boss, but it's being responsive and pleasant to everybody. And so it's some accountability around that. Wellness Wednesdays is a email that comes out from our human resources department that is simply just self-care tips, healthcare tips, wellness tips, just things to, again, continue the conversation and thought around that we care about you taking care of yourselves and your well-being. And acknowledgements. This can't be overstated. We see the value in acknowledging the work we do. If you work like us in a fast-paced environment, we often forget to reflect or don't have time or energy to reflect on the accomplishments and the good work that's happening. We're just kind of moving on to the next thing. And so to be intentional about it, taking time and acknowledging in behavioral health, we always do it at our staff meetings because it's so important to elevate the good work that's happening, especially in times of stress. Dr. Eidson-Ton takes agency-wide, she sends out an email where she sends agency-wide acknowledgements and receives feedback from everybody. So anyone can make an acknowledgement that goes to the entire agency. And of course, each agency has a different way of doing this. You have to find what's best for you. And being acknowledged doesn't always have to be public, and it doesn't always have to be a compliment. It's also being acknowledged just being acknowledged for who you are and the work you do. And as an example, we had a behavioral health clinician that was, struggling with stress, and they had to do a stressful presentation. And they told me that their supervisor had texted them and just said, "Hey, I remember you're doing that presentation today. I just want to know, I'm thinking about you and good luck today." And there was something about that experience for this person of like having their supervisor remember this was happening, send them a text that probably took 30 seconds, but they felt seen and they felt acknowledged at their work. They weren't just another person, but people were remembering and learning about who they are and what they were struggling with. And that was really meaningful. So it takes all of us caring for each other to make this work. And if there's any takeaways from this is that choices should be offered, that people are empowered to engage in lots of different ways, and that the relationship we have with people and people being seen is really foundational. And maybe donuts, if that works for you and your agency. So in conclusion, we want to proactively and comprehensively build resilience in individuals, workforces, and systems, including healthcare workers, healthcare organizations, and the healthcare system, in order to promote healing and to meet the demands of our future. And at this point, we have some time for questions and answers, if there are some. Thank you.
Well, first off, let me acknowledge and thank you again for that really rich presentation and a lot of information that you were able to share there. So thank you for doing that. And even just for myself, as I was listening, one of the things I acknowledged was that I saw parallels to other sectors. I think in this moment, we're seeing some of the same issues in education. Police and fire experience a lot of some of the same challenges. Can you talk about how this work might impact other sectors beyond just healthcare? Are there implications for other areas?
I can start. I think it's all the same. I think that and I think we're seeing this for the last couple of years, is that everyone's walking through this struggle together, and that everyone has moments of feeling disconnected for the reason that they started doing the work that they're doing, or disconnected from relationships, or wanting to be seen and heard by, the work that they're doing. And so I think I think that the connection is absolutely applied to every sector. I'm not sure that, I think it's a clear path walk. I think when you're working with the public, of course, there's an added pressure that can happen, but there's lots of jobs that do that. I don't know if it's other.
Yeah, I'm always amazed when I read about things or learn about things, how it really, or hear about things in the educational sector or about new things in parenting. It really all comes down to the same kind of principles of, first of all, the caregiver needs to take care of themselves, or we need to take care of each other, of the caregiver, in order for us to care for others. And yeah, so all these different sectors really align very well in that.
Yeah, I think so. And I would also say, I think it's kind of ironic, I think, in some ways, that in the healthcare sector, we're a little bit late to coming to this idea that we need to take care of ourselves, even though, that's been talked about, like heal thyself, and for such a long time. I think there's still, and that's the whole reason for that, that Congress passing that act around that emergency room physician who died by suicide, because there's been shame, right? Like as healthcare workers, there has definitely been this idea that we're supposed to care for everyone else, but we're supposed to be strong, and and there's kind of a shame and admitting that you're human as well, and that you have mental health challenges or whatever it is. And so I think that's really what I think the pandemic has illustrated to us that like we have to get past that. Like we have to pay attention to this, and we have to take these lessons from all these other places and really apply it to healthcare as well. So.
Thank you. I think one of the questions that would be out there is just, are you seeing resistance? So understanding healthcare as a system, I mean, you've got doctors, you've got nurses, you've got support staff. Are you seeing resistance from any specific areas of healthcare? And that's kind of allowed you to, again, think about a strategy and how do you create a comprehensive system of change?
Well, I can start. I think one thing is that just the healthcare system in general is a problem, really. The way that it's organized, the way that we're reimbursed for caring for patients in a fee-for-service manner, all of that sort of makes it challenging to implement these kind of changes that we're talking about. And so we all, are trying to find creative ways within the system that we work to do that. But I think really keeping resiliency and wellness in mind as we're thinking about changing the systems at the state level, at the national level is really important. I don't know if you want to add anything to that, Erika.
I was just going to say, I think it's a matter of like locus of control, like what are the things that we can or cannot control. And I mean, I think it needs to have sort of both of these things. Like we need to do the things we can control immediately and right around us. And also we need to contribute to the big picture. And so I think what we can do within CommuniCare, and I'm exceptionally lucky to be, I'm here with my Chief Medical Officer and our Chief Behavioral Health Officer. Clearly there's a lot of support in the organization for this. And I think that's really wonderful. And also, I think healthcare workers getting more involved in advocacy at the state and at the national level, at the local level, is really important in order to drive some of the bigger picture changes that will be necessary and that are necessary to ultimately achieve the goal of resiliency in healthcare.
And just to add to that, transparently communicating to people that you work with what you have control over and what we don't. A lot of times there's assumptions made about ways that things are, that it's about maybe CommuniCare decided that. And so even being able to say, actually, that's our billing system or that's our state, the state regulation is empowering for people to understand and feel connected about the why. Like, why is this decision being made? Why are visits set up this way? And so any way that we can do that too.
Great. So there's a question from a member of our audience asking, where would you start as an organization to start modeling or building or working on some of these policies and practices to help become a resilient organization? Where would you suggest they start?
It's hard to know. It's hard to know what the right answer to that is, but my inclination or my first reaction is to say to talk to the people that you work with and get feedback for what's working and what's not. I mean, I think that drives the relationship. I think it drives, the direction of, every workforce has its own culture and way, but beginning that dialogue about what's working and what's not.
I think if possible, getting buy-in from leadership is really helpful, and in whatever way that might look like for an individual organization. But yeah, because leadership can really drive sort of the focusing on things that we can do as a team right now in the now, and also allow for that sort of bigger perspective on bigger picture changes.
I'm curious for you all too, where do you think this work looks like in 5 years or 10 years? What does that program really look like? And it sounds like you have a big scope and a big vision, and there's a big task there. But what do you think it might look like?
Well, I think there are a few parts to that. I mean, I think definitely thinking about how to be more flexible in our work environment for healthcare workers is really important, so that we can really support people in where they are in their lives and help them, and there are these changes happening, but for, working mothers being able to work more part-time initially and then be able to increase that time as their children age, and just things like that. I think having that be the norm as opposed to the exception, I think, is one thing. But I think the other thing is also, you know, around what I was talking about around the moral injury. I mean, I really think what's key as well is to have a better system for our patients and our clients, where we really feel like we're giving them the care that they need when they need it in the best way. Because I think when we are part of a system where we feel like we're actually accomplishing things and improving people's lives, that makes all the difference in how we feel connected to our work and our wellness too. So.
And I would add that this may be obvious, but I feel like 5-6 years ago, there was sort of this feeling of like people come to work and they do the work and they go home, right? And I feel like the last few years and just the awareness around mental health that's happening is that people are realizing that people are whole, complex, messy, imperfect people, and that we have to think about our workforce as human beings, and whatever ways in which we can create flexibility in relationship, that's going to be a part of work. It's not going to be as separate, I think, as it maybe once was for a lot of people.
Great. And as you're running through the presentation, one of the thoughts I had is just a question about what would a customized wellness plan look like? And you kind of gave some examples, but what does it look like to an employee at CommuniCare? What does it look like?
I mean, I think it's really difficult to answer, but just some examples. For example, if what it can look like very concretely for a medical assistant is to say, hey, I only have childcare starting at 8:30. Can my schedule be adjusted to only start at 8:30? I need to go pick up my child from 3 at 3. Can I please adjust my schedule? So from 3 to 3:30, I cannot be here, and not experience a ton of pushback and saying like, oh, excuse me, that is, your schedule is 8 to 5. But yes, you are human, you're a parent, you have responsibilities outside of this work. And we can make it adjust within what is possible, within what we do have control over. Other things, I think the empowering people to contribute, the encouraging participation at levels that are really, people are really realizing that what they say and what their ideas are taken seriously. And so it's not like this is your plan, is that you're going to participate, but people are encouraged and they tend to feel better and feel empowered when their voice is being heard and their ideas are actually taken up and put into action when it is possible.
Yeah, I just want to say, I think a great example of that is both our diversity, equity, and inclusion committee, as well as our trauma-informed, resiliency-oriented healing center champion committee. It's kind of a long name, but we really encouraged medical assistants and dental assistants and other frontline staff to be part of those committees. And they're full members of the committee. They make decisions about the direction of the committee and the things that we're going to work on. And that's just a concrete example of what you're saying, Erika.
A mentor of mine I told him once, I said, wow, it really feels like our voice matters. And he said, no, it doesn't feel like that. Your voice matters, period. It's not just that it feels like that. And I think that's really the key.
Great, that was great. I guess in closing, I would just ask, because I think we had a great presentation, we learned a lot. I'm kind of curious for you three, what is your form of self-care at this moment? What's a model of self-care you would share with your team that you're doing for yourself?
When I take days off, I try to model not checking email, and I announce I say, I'm taking a few days off. I'm going to be out of the office. This is what I'm doing. And I'm not always perfect in not checking email, but I think even just declaring, like as a leader, that I'm doing this and this is my expectation for myself that I'm going to try to do, really gives people permission to also be able to do that.
Yeah, I think one thing I try to do is whenever I can, if I'm meeting with one person, trying to take a walk during that meeting. So actually my boss and I, usually that's how we meet, is we take a walk together. And that to me is just so important for my mental health, to get outside and get moving. So that's one for me.
Yeah, for me, I think also there's, the little normal things like allowing myself to sleep enough. That's really big for me. Is, I sleep and I prioritize that, and I will tell anybody who cares to know, and including my children, and also taking time off and really making that break. Preferably I go camping somewhere where there's no reception, because then there's just no discussion around it. And so I think those are some things that I really appreciate. And asking for help. I think that's another one where, for example, exercising is really difficult for me. And so I ask friends for help. I said, hey, I need some accountability from someone else to because I know I will feel better. But asking for help when I need it, I think, is another big one for me.
Well, thank you again to the three of you for joining us today. It was very informative. I think CommuniCare is doing a great model here that could definitely be replicated, like we said, with some other sectors. So thank you again for all the work that you're doing. So we have Dr. Roshanravan, we have Dr. Eidson-Ton, and I apologize in my intro if I didn't introduce yourself as the Chief Medical Officer at CommuniCare. Looking at my notes, and Sara Gavin. So thank you again for joining us. So with that, I just want to close out with just some brief comments. We wanted to share some of the upcoming activities that are coming up. If you didn't see, we were able to extend. We have a 4th workshop that we recently just added. It's going to be Resilience in Families on Friday, April 8th. We're going to be fortunate to have Gina Deladen from First 5 Yolo and Jennifer Lahai from Yolo County Children's Alliance in attendance, and talking a little bit more about how families can build their resilience. And last but not least, we are really excited again to have an in-person Building a Resilient Yolo Summit. It's going to be happening on Thursday, May 12th at the Woodland Community and Senior Center. And we are planning an in-person event. We'll also have a virtual option as well. So if you're looking at this and you haven't registered, please go ahead. We encourage you to do this. It is a free event. It includes breakfast and lunch, and you can register at the link that's on there, bit.ly Resilient YOLO Summit 2020. And again, we're really just fortunate to have all of our sponsors and supporters that have helped us be able to plan that conference. So again, thank you for your time today. Thank you to our presenters that shared, and we'll see you at the next event. Have a great day.